Hello, I'm Dr. Preeti, consultant psychiatrist from Spandana Hospital, Rajajinagar, Bangalore. Today I'm going to talk about women and her mental health issues. The society needs to be sensitized about women and her mental health issues. For a woman to be mentally fit, she needs to be resilient to all the adversities that life throws at her. She should be able to have meaningful relationships. She should be able to have a balanced life and should be able to resolve conflicts in the absence of mental disorder. But it's quite interesting to know that women have mental disorders almost 2 to 3 times more than men. Some of the common mental disorders like depression, anxiety, and somatic complaints are quite common in women. Disorders like premenstrual dysphoria, peri and postnatal depression, and perimenopausal symptoms are quite unique in women. But the question is, why are women more subjected to mental disorders? While the reasons can be a triad of biological, psychological, and socio-cultural reasons. Coming to the biological aspects, we know that woman is subjected to various physiological variations in her lifetime. During pregnancy, during menopause, during childbirth, there are a lot of hormonal imbalances in the body which can secondarily affect certain neurotransmitters in the brain, and she can be subjected to depression. So coming to the psychological aspects, women who are vulnerable to certain stress, it can be like a childhood abuse, severe psychological stress like separation, severe interpersonal conflicts, being single. So these certain psychological stress can precipitate a disorder in a woman who are vulnerable. The third reason can be because of certain socio-cultural causation. Probably it can be the way she relates to the outside world in terms of internalizing her emotions, or it can be because of certain gender disadvantage the woman is in terms of trying to fit into certain role like as a mother, as a perfect wife. So certain socio-cultural biases also can be a causation for certain disorders. So it is very important for the society at large to recognize these symptoms and not label these emotions as just she's overreacting or it may be a part of personality, but trying to understand that these may be certain symptoms of an underlying disorder. So whenever a woman has symptoms of depression, it can be of various emotions. She can complain of pervasive sadness, sense of hopelessness, suicidal ideations, crying spells. There can be change in appetite and sleep patterns. These are certain warning signs we need to look out for if there is an underlying cause of a mental disorder. So, what do we need to do as a society in large? The first step involves identifying, psychoeducating the family members, breaking down the stigma, and giving her the right kind of psychological and pharmacological help. So, I feel that in terms of the entire health system, the woman's mental health should be the topmost priority. Thank you.